Hi, my name is Chris Nicholson, co-founder and CEO for mPulse Mobile. We've developed a conversational AI platform that really helps healthcare better engage, better communicate with patients and members across America. SJF was introduced to us by an existing investor actually in a referral, and so as we moved from sort of Series A investment to Series B, you start to create a tighter network of the types of companies you want to work with. We loved the impact nature of their investing strategy, but still with an eye to outcomes and returns. And so we're motivated by those factors, and our mission is to help improve health outcomes, but obviously build a big business and something that's scalable for our existing partners as well. They met that, I think, in a couple different categories, and we're really trusted and respected by the other investors on our board. And I think from a partnership perspective, what I respect, I think, most about the team that we work with at SJF is they're realistic and they're really rational. And that may sound odd, but if you've ever worked with a lot of venture capital partners before, rational is not always the way you describe some of them. And so we really like the way that they are quick, from a decision perspective. We can put ideas on the table, sort of soundboard different, perspectives, and then get some really clear feedback that then we can action, appropriately within our business as well, versus, taking weeks or months to sort of, go through that analysis paralysis. I think a lot of it comes to the foundation. A lot of them were bankers or sort of investors in previous walks of life, so they can look at deals and deal structure very quickly and sort of assess value to make those decisions. From a positive impact standpoint, we are focused on improving health outcomes, and so it could be, reducing gaps in care, helping people get the services or treatment that they're needing with their particular partners. Those could be things like medication adherence, well-child visits, flu and immunization, just making sure people are getting the medications that they need to take care of themselves. And so all of those things come together to drive those health outcomes. So our vision and our purpose is all about, making communication simple, making sure we can provide access to those underserved populations as widely as possible, in the preferred channel that they want to engage in. Scale is really important to us, right? In healthcare, scale matters. We'll probably communicate 250 million digital engagements this year, supporting 36 million Americans. My aspiration is that within the next 2 years, we'll be servicing over 100 million Americans and getting that over 1 billion interactions. And so the value of that is not by the sheer volume of communications or dialogues, but by the data and the learning that we actually have through those dialogues. So then we can be much more predictive in the responses of who's going to engage, who's not going to engage, who's taking care of their health, who's not. What are the ways that we can leverage social determinants of health to really steer people to the services and the care that they're looking for. SJF is instrumental in helping us achieve those goals because they are really sort of a guidepost back to mission. And so one of the things that always comes up in our board meetings is that sort of gut check that says, does this align to your vision? Does this help support the purpose? Because we get distracted sometimes, and I think they've been really good stewards of that mission and sort of making sure that we actually live up to those values as well. And that's been helpful because sometimes we do get sort of carried away in the discussions, and there's lots of opportunities and lots of different paths that we can choose, and they've been a good sounding board for that.